55-year-old patient, presents to the emergency department with a sudden onset of severe back pain after lifting a heavy object. The pain is sharp, localized to the lower back, and worsens with movement. The patient denies any history of trauma or previous back pain. Which of the following conditions is most likely responsible for the patient's symptoms? A. Herniated disc. B. Spinal fracture. C. Sciatica. D. Degenerative disc disease. The correct answer is A. Herniated disc. Explanation: the question describes the sudden onset of severe back pain after lifting a heavy object, which is characteristic of a herniated disc. The sharp, localized pain that worsens with movement is consistent with nerve root compression caused by the herniated disc. A spinal fracture, option B, is a possibility, but the absence of trauma or previous back pain makes it less likely. Sciatica, option C, refers to pain radiating along the sciatic nerve and may be associated with a herniated disc. Degenerative disc disease, option D, is a chronic condition and typically presents with gradual onset and worsening over time. A 75-year-old patient is admitted to the emergency department with a suspected hip fracture after a fall. The nurse performs an assessment and notes the patient's leg appears shortened and externally rotated. What type of fracture is most likely present? A. Green stick fracture. B. Comminuted fracture. C. Spiral fracture. D. Hip fracture. The correct answer is D. Hip fracture. Explanation: the question describes a hip fracture with the leg appearing shortened and externally rotated, which is a characteristic of this type of fracture. A green stick fracture, option A, is a fracture common in children due to their pliable bones. Option B, a comminuted fracture, involves fragmentation of the bone into multiple pieces. Option C, spiral fracture, involves a fracture line that spirals around the bone and is commonly associated with twisting injuries, but it does not typically cause shortening and external rotation of the leg. A 30-year-old male presents to the emergency department with a fractured arm after a fall. The nurse assesses the patient's arm and notes crepitus, swelling, and tenderness over the fractured area. The nurse suspects a closed fracture. Which of the following interventions should the nurse prioritize? A. Applying a cold pack to the fracture site. B. Immobilizing the fractured arm with a splint. C. Administering analgesics for pain relief. D. Assessing the neurovascular status of the affected arm. The correct answer is D. Assessing the neurovascular status of the affected arm. Explanation: the patient's signs and symptoms indicate a closed fracture, which refers to a fracture where the skin remains intact. Assessing neurovascular status is the priority intervention to ensure adequate blood flow and nerve function to the affected arm. Options A, B, and C are important interventions but are secondary to ensuring the patient's neurovascular status is intact. A 16-year-old athlete is brought to the emergency department with a suspected stress fracture in the foot. The nurse is providing education to the patient about managing the condition. Which of the following statements by the patient indicates an understanding of the nurse's teaching? A. I will continue my regular training routine to strengthen my foot. B. I will take ibuprofen regularly to reduce the pain and swelling. C. I will use crutches and avoid putting weight on my foot. D. I will apply heat packs to the affected area to promote healing. The correct answer is C. I will use crutches and avoid putting weight on my foot. Explanation: stress fractures are overuse injuries that occur due to repetitive stress on the bone. The treatment typically involves rest and avoiding weight-bearing activities to allow for healing. Option A suggests continuing the regular training routine, which would exacerbate the injury. Option B mentions using ibuprofen, which may help with pain and swelling, but it does not address the need for immobilization and rest. Option D suggests applying heat packs, which are contraindicated in acute injuries as they can increase swelling and inflammation. Option C reflects the appropriate understanding by the patient. A 45-year-old patient is admitted to the hospital with multiple rib fractures following a motor vehicle accident. The nurse is assessing the patient and notices paradoxical chest wall movement during respiration. Which of the following complications should the nurse suspect based on this finding? A. Pneumothorax. B. Pulmonary embolism. C. Hemothorax. D. Flail chest. The correct answer is D. Flail chest. Explanation: paradoxical chest wall movement refers to a condition called flail chest, which occurs when a segment of the chest wall becomes detached from the rest of the thoracic cage due to multiple rib fractures. During inspiration, the detached segment moves inward instead of outward, causing a paradoxical movement. This finding is characteristic of flail chest. Options A, B, and C are potential complications associated with rib fractures but do not specifically manifest as paradoxical chest wall movement. A 65-year-old patient presents to the primary care clinic with complaints of joint pain, stiffness, and swelling in the hands and wrists. The patient reports experiencing these symptoms for several months and mentions difficulty performing daily activities. Upon examination, the nurse notes the presence of bony nodules on the distal interphalangeal joint, Heberden's nodes. Which type of arthritis is most likely present? A. Rheumatoid arthritis. B. Osteoarthritis. C. Gouty arthritis. D. Psoriatic arthritis. The correct answer is B. Osteoarthritis. Explanation: the vignette describes a 65-year-old patient with joint pain, stiffness, and swelling in the hands and wrists, along with the presence of Heberden's nodes. Heberden's nodes are bony nodules that typically develop in osteoarthritis, particularly in the distal interphalangeal joints. Rheumatoid arthritis, option A, is an autoimmune disease characterized by symmetrical joint involvement, morning stiffness, and systemic symptoms. Gouty arthritis, option C, is caused by the deposition of uric acid crystals and typically affects the big toe. Psoriatic arthritis, option D, is associated with psoriasis and may involve the skin, nails, and joints, with distinctive features like dactylitis and nail changes. A 50-year-old female patient presents with recurrent episodes of joint inflammation, particularly affecting the right knee. The patient reports severe pain, redness, warmth, and limited range of motion during these episodes. Laboratory tests reveal elevated serum uric acid levels. Which type of arthritis is most likely responsible for the patient's symptoms? A. Rheumatoid arthritis. B. Osteoarthritis. C. Gouty arthritis. D. Ankylosing spondylitis. The correct answer is C. Gouty arthritis. Explanation: the vignette describes a 50-year-old patient with recurrent episodes of joint inflammation, particularly affecting the right knee, along with severe pain, redness, warmth, and limited range of motion. These symptoms are characteristic of gouty arthritis, which is caused by the deposition of uric acid crystals in the joints. Rheumatoid arthritis, option A, typically involves symmetrical joint involvement, morning stiffness, and systemic symptoms. Osteoarthritis, option B, is a degenerative joint disease that is not typically associated with acute episodes of joint inflammation. Ankylosing spondylitis, option D, primarily affects the spine and sacroiliac joints, causing chronic pain and stiffness. A 42-year-old patient sustains a fracture of the tibia and fibula in a motor vehicle accident. The healthcare provider determines that the fracture is an open fracture. Which of the following interventions should the nurse prioritize during the initial management of an open fracture? Select all that apply. A. Immobilizing the fracture site with a splint. B. Administering prophylactic antibiotics. C. Covering the wound with a sterile dressing. D. Assessing the neurovascular status of the affected limb. The correct answer is B. Administering prophylactic antibiotics, and C. Covering the wound with a sterile dressing. Explanation: in an open fracture, the skin is broken, exposing the fracture site to the external environment. The priority interventions in the initial management of an open fracture include administering prophylactic antibiotics to prevent infection and covering the wound with a sterile dressing to protect against further contamination. Option A, immobilizing the fracture site with a splint, is important but is not specific to open fractures. Option D, assessing neurovascular status, is necessary but does not directly address the open fracture. A 35-year-old office worker complains of chronic low back pain that worsens with prolonged sitting and improves with walking or lying down. The pain is described as dull and achy, and there are no signs of radiculopathy or neurological deficits. Which of the following conditions is most likely causing the patient's symptoms? A. Herniated disc. B. Spinal stenosis. C. Musculoskeletal strain. D. Ankylosing spondylitis. The correct answer is C. Musculoskeletal strain. Explanation: the vignette describes chronic low back pain that worsens with prolonged sitting, which is commonly seen in musculoskeletal strain due to poor posture or prolonged sitting. The absence of radiculopathy or neurological deficits makes conditions like herniated disc, option A, and spinal stenosis, option B, less likely. Ankylosing spondylitis, option D, is a chronic inflammatory condition primarily affecting the spine, but the symptoms described in the vignette are more consistent with musculoskeletal strain. A 55-year-old patient undergoes surgical repair of a fractured hip. On the second postoperative day, the nurse observes the patient attempting to move the affected leg independently without following the prescribed weight-bearing restrictions. What action should the nurse take? Select 2. A. Reinforce the importance of adhering to weight-bearing restrictions. B. Inform the healthcare provider about the patient's actions. C. Apply a restraint to the affected leg. D. Encourage the patient to continue exercising the affected leg. The correct answer is A. Reinforce the importance of adhering to weight-bearing restrictions, and B. Inform the healthcare provider about the patient's actions. Explanation: following surgical repair of a fractured hip, it is crucial for the patient to adhere to weight-bearing restrictions to promote proper healing and prevent complications. The nurse should reinforce the importance of adhering to these restrictions to the patient to prevent further harm. Additionally, the nurse should inform the healthcare provider about the patient's actions so that appropriate interventions and further evaluation can be initiated. Applying a restraint to the affected leg, option C, is not the best course of action as it may increase the risk of complications and compromise circulation. Encouraging the patient to continue exercising the affected leg, option D, is contraindicated as it may worsen the fracture and impede the healing process.